Hello anatomy colleagues, this is Dr. Alsop, and in this supplementary dissection video we're going to focus on the meninges as well as getting an idea of where some of those spaces or meningeal spaces would be located, both actual and potential spaces. So we are looking at a spinal cord right here, a portion of the spinal cord, and the dura mater has been opened. So the dura mater is what is being held by these forceps right here. And you can see how thick this dura is in comparison to some of these other structures right here. And you see a bit of the dura over here as well. The dura, as we know, is that outermost covering of the meninges. It's that toughest one. And I'm going to skip over the subdural space for just a moment so I can let you have kind of an idea of the arachnoid mater. And usually the arachnoid mater is very closely adhered to the dura mater, and so you would have no space there. But during the embalming process, sometimes it can stay adhered to the dura, sometimes it becomes kind of collapsed and will adhere more towards the pia mater. But in this particular dissection, you can see kind of this filmy appearance that is the arachnoid, and you can see some of those arachnoid trabeculae that give the arachnoid its name and that spider-like appearance. And the subdural space would be the space between the arachnoid and the dura mater. All right, so it'd be somewhere right about here-ish. But keep in mind that the subdural space is a potential space, meaning that there really should not be a space between these two structures. Occasionally it can become an actual space or a real space if something enters the area, say like blood. If blood entered into that region, kind of creating a space between the dura mater and the arachnoid, that would be a subdural hemorrhage. So this is a potential space, and we just kind of want you to get an idea of where these would be located in terms of the dissection. The space between the arachnoid mater and the pia mater would be the subarachnoid space. Okay, so this area right about here-ish, which is greatly exaggerated in terms of its size because the forceps are pulling the dura for us to be able to view these things. But the subarachnoid space is an example of an actual space or a real space that is present without pathology. And during life, you'll have cerebrospinal fluid that will be flowing through there. You can have neurovasculature that's also moving through the subarachnoid space. The pia mater is almost completely impossible really to remove from the central nervous system, so from the spinal cord or the brain. It's so very closely adhered to that structure. It's what kind of gives that region that shiny appearance that you can see. So the pia mater will be directly on those portions of the CNS. This is a different view with the dura mater not being cut. So in this particular dissection, this is a laminectomy was completed. So the lamina, the spinous processes were removed because we're looking at a very posterior view. So that portion of the vertebral arch has been removed, and as well as the epidural fat, because that epidural space would be in this region here, the space between the bone and the dura mater. And you can see just how robust and thick the dura mater is. And in order to be able to see the spinal cord, you would have to make an incision and reflect open in order to get into those deeper structures. Let's talk a specialization of the dura mater called the phylum terminale. Oops, this should be an E right here. My apologies. Externum. Often referred to as the coccygeal ligament. And after the dural sac terminates, so the dural sac is around S2, you can see it kind of comes to a point right here, and the rest of this portion of the dura has been reflected in order to see those portions. So right where the dura mater ends, or that dural sac ends, you will have a small extension of the dura mater that will continue all the way to the coccyx. And what this does is it will play a role in terms of anchoring the dural sac to the coccyx. And it will also envelop the phylum terminale internum, which is an extension of the pia mater. So the internum will travel through the dural sac, and then once it gets to this region at the end of the dural sac, the phylum terminale will envelop that, and they'll kind of travel together as a coccygeal ligament. There are two specializations of the pia mater that we want you to be familiar with. The first is the denticulate ligaments, and these are paired extensions of pia mater that will, as it suggests, it will extend away from the pia mater, and it will be on either side, and these will attach to the dural sac. So you'll have the extensions of the pia extending all the way to the dural sac, and they will appear kind of this opaque white compared to the rootlets and the roots in this region. So you can see it extending all of this region. It will kind of be in between the dorsal and ventral roots and rootlets of the spinal nerves. And usually you have about 20 to 22 pairs of these, so you may not have them at every vertebral level, but you have to kind of get really into that deeper portion and be right at that spinal cord in order to see these denticulate ligaments. Again, similar to what we had with the phylum terminale externum, this is going to play an anchoring role. And I mentioned the phylum terminale internum when discussing the externum. This is going to be an extension of the pia mater. So right here, I'm going to draw a line around what is referred to as the conus medullaris. And we'll talk about that in a bit more detail in another video. But basically, this is the tip or the end of the spinal cord, which occurs at around L2. And from there, you're going to have extensions, or you're going to have roots that are going to extend from that region called the cauda equina. Again, we'll discuss that in more detail in another video. But you will have a little bit of the pia mater meninges extending past the conus medullaris and traveling through the dural sac region, kind of in the midline, till you get to the end of the dural sac at about S2. So this is S2, conus medullaris, or the tip of the conus medullaris is about at L2. So you'll have it extending from this space to this space, and then it will be enveloped by that phylum terminale externum, or the coccygeal ligament. It will be opaque white. You can see a little bit of that right there, I think pretty well, in comparison to the surrounding cauda equina. All right, excellent. Meninges are always fun. Sometimes you can see them really, really well in a dissection, sometimes not quite as well. So it might behoove you to kind of look at as much variation as you can in those regions. But at least conceptually understanding where they're located and getting an idea of those spaces can be helpful as well. All right, thank you for your time and attention here. And if you have any meninges questions, you can always feel free to reach out to myself or any of my anatomy colleagues. Thank you for your time and attention here, and have a great rest of your day.